Thank you. Good afternoon, everyone. I'm so glad to be here to join the meeting and also to present the study in China to you all. And actually, as just Professor West mentioned, that dentine hypersensitivity is a short, sharp pain. This condition actually is common in different population, and also it is related or highly affected the oral health related quality of life. Oh, sorry. Yeah, which one? Actually, the first national epidemiological survey on dentine hypersensitivity in China was conducted in the year 2008. At that time, about 8,000 adults from 6 cities aged 20 to 69 years old involved the study. And the self-reported dentine hypersensitivity was reported in 40.7% of the adults. And when combined with clinical diagnosis, it was reported as 29.7%. And during the last decades, as everyone knows that China has witnessed the dramatic changes in the increasing of life expectancy and retention of teeth through whole life, and changes of lifestyle and diet, and also increasing intake of the soft drinks. And also there is no more data on erosive tooth around the China adults, and it is reported strongly related to the dentine hypersensitivity. Therefore, based on the supposition of the Heilong, we conducted this epidemiological study in China to determine the prevalence of dentine hypersensitivity and its associated factors in urban adults, compare the result with that in the year 2008. And this was designed as an observational cross-sectional epidemiological study carried out in adults aged 18 to 69 years old adults in 7 cities in China. A multiple stage stratified sampling method based on subjects' gender, age group, and location was used to obtain a representative sample of adult population in the 7 cities, which are Beijing, Shanghai, Wuhan, Chengdu, Xi'an, Guangzhou, and Harbin, which represent different part of China. And the total sample size was designed as 12,180. First, during the study, each subject was asked to complete structured questionnaire by face-to-face interview, which included the demographic backgrounds, self-perception of dentine hypersensitivity, oral health-related habits, dietary, and personal medical history. After that, each volunteer was asked to complete a clinical examination with dentine hypersensitivity using the Schiff air blast scale, and also for those sensitivities, we collected the data on periodontal status such as pulp depth, gingival recession, and loss of attachment. The erosive tooth wear was conducted only for the young adults younger than 40 years old, using the BV scale, basic erosive wear examination. And all the data were analyzed by independent sample t-test, ANOVA, chi-square, and also biovariate logistic regression. For the results, due to the pandemic Actually, we collected the data. It lasted for about 2 years, from July 2021 until May this year. Overall, 11,622 adults were recruited from the cities, about half and half in gender distribution. For the prevalence of dentine hypersensitivity, as Professor Weston mentioned, that we measured in 3 criteria. One is self-reported, and then clinical diagnosed with SHAVE score in binary, and also the highest SHAVE score as 2 and 3. For all these 11,000 subjects, self-reported hypersensitivity was reported in 52.2%. And with clinical diagnosed with binary score, SHAVE score, the prevalence was 36.7%. 36.7%. But for the highest SHAVE score as 2 and 3, the proportion was only 9.8%. When we compare the different cities, as in this city, Harbin is in the northeastern part of China, and Guangzhou is the southeastern part of China, and Beijing represented the north part, Wuhan and Xi'an as the central part of China, and Chengdu as the west southern part of China. So the difference is very, in prevalence of dentine hypersensitivity, is very clear in these different areas. We found the highest prevalence as clinical diagnosed is in Harbin, the very northeastern part of China, 53.5%. As the lowest was found in Xi'an, just 18.6%. It is similar with those self-reported. The highest was found in Harbin, and also the lowest was found in Xi'an. But when we use the SHAVE highest score as 3 or 2 different was found, the highest was found in Chengdu, 18%, and the lowest was found in Beijing, only 1.8%. When we consider about the age groups, it is clear from the younger to the elder, with the age increase, the prevalence of self-reported dentine hypersensitivity increased, except the oldest age group. So the highest was found among adults aged 50 to 59 years old. But as we compare the clinical diagnosis, binary diagnosis, we found that it is increased, the prevalence increased with the age. So the highest prevalence was found in the 60 to 69 years old. And the mean number of sensitivity teeth was 1.5 per subject. And the commonest teeth affected were the premolar teeth and the cervical part of the teeth. So when we compare the data about 15 years ago, it is very clear that the prevalence increased from 29.7% to 36.7% in 7%. And the mean number of teeth affected by sensitivity also increased. For the gender, both male and female increased in the prevalence, but the more increase was found in male, from 23.4% to 34.1%, almost 11%. And also, among the age groups, the high was found, the increase from during these 15 years was found in the younger age group as 18 to 29 years old, and also for the older age group, 60 to 69 years old. The most increase was found in the 60 to 69 years old. And between the cities, this time we found the lowest percentage of dental hypersensitivity in Xi'an and the highest in Harbin. But 15 years ago, the lowest was found in Chengdu and Xi'an. The highest was found in Guangzhou. And factors associated with dental hypersensitivity with logistic regression analysis, we found that the first one, age group, and then gender. Female suffered very more prevalence of the male, and also location, geography location, and also brush method, and also the acid reflexes. For the tooth wear, it is very clear more tooth wear, more common for dentin hypersensitivity. So the erosive tooth was strongly associated with dentin hypersensitivity. Among all the subjects with dentin hypersensitivity, the most common reason to trigger teeth sensitivity were cold and acid and hard stimulus. And also the dentin hypersensitivity, the impact of dentin hypersensitivity on the oral health related quality of life were found in the following areas, such as having problem of eating cold food, taking out pleasure, and avoiding certain teeth, taking a long time for chewing, and changing the way of eating. Of all subjects who self-reported dentin hypersensitivity, 43% of them had received some treatment, and most of them used desensitizing toothpaste to relieve sensitivity. So in conclusion, dentin hypersensitivity was common among urban adults in China nowadays, and the prevalence of dentin hypersensitivity increased with age. However, young adults suffered more dentin hypersensitivity than 10 years ago in China. And people's perception of their pain is more than that of clinical reporting. Actually, age, gender, location, toothbrushing method, and acid reflux and tooth wear was strongly associated with dentin hypersensitivity. And dentin hypersensitivity not only affects the patient's physical health, but also affects their social function and psychosocial well-being. So better understanding of the dentin hypersensitivity and its associated factors can assist us on resources planning for reducing or preventing any discomfort arising from this condition, and will also aid in the decision-making process. And thank you.